Hello, my name is Chelsea Kotsiras, Director of Grant Writing and Administration for the Charleston Metro Chamber of Commerce. I'm here today to talk to you about our regional action plan, which is focusing on promoting economic mobility for marginalized communities in the Charleston metro area. There are truly significant disparities that prevent low-income and minority individuals from accessing good quality jobs, leading to economic mobility. Addressing these issues is crucial to fostering an inclusive and equitable workforce environment, which is why we have developed a regional action plan to support individuals in overcoming career-related barriers that have been created by economic, educational, and other disparities that are existing in our region. All individuals really need access to training and education necessary to pursue quality career pathways. The healthcare sector in particular holds great potential to provide an inroad to economic stability for those that are in low income and minority communities. That's why for this regional action plan, we are focusing on the healthcare sector. This sector in particular accounts for 15% of all jobs in Charleston. It has an average annual growth of 1.7%, and it has median annual earnings of just over $67,000 per year, which means it's leading people to jobs that have livable wages and stability for the future. On this slide, you'll see a breakdown of the problems we're hoping to address. Firstly are those historic inequities, systemic barriers, and socioeconomic disparities that I've already mentioned that are impacting people's access to economic mobility. The second is a need to support the growing healthcare workforce in the Charleston metro area. As I've already mentioned, it accounts for a large majority of the jobs here, and we want to make sure that we're filling critical roles as needed. And then finally, developing solutions that can tackle both of these issues together and bring them to meet in the middle and find something that fits for everyone. Developing and implementing workforce-related solutions is a task that cannot be handled by one entity alone. A healthy talent pipeline depends on complex ecosystem of government, employers, higher education institutions, training providers, and community organizations, all playing a critical role in achieving strategies that have been developed together. Bringing these stakeholders into one partnership requires a non-biased convener that maintains a focus on regional impact as opposed to individual interests. Charleston Metro Chamber of Commerce has naturally stepped into this role for our region. We've leveraged existing relationships and financial resources gained through federal grants to establish a strong healthcare sector partnership. You'll see a diagram of this partnership on the screen with our employers at this center table surrounding an equity council. It's important that our employers are driving our agenda and staying engaged while also being guided by an equity council that ensures we are looking at all of our strategies through the correct lens and not leaving anyone out. You'll see a outer ring that includes other organizations like educational institutions, nonprofits. All of these are integral in implementing the solutions that I will talk about in a little bit. You'll also see BCD COG in a triangle in the corner there. They are a supportive organization in helping us to convene all of the players at this table. The BCD COG represents our local workforce board, who also has dedicated federal resources to achieving the same goals. The Chamber approached the convening of its sector partnership through the utilization of trusted methods. Talent pipeline management, for one, which was developed by the U.S. Chamber of Commerce, has guided the engagement of employer partners. It prioritizes data collection to ensure development of evidence-based workforce solutions. We paired this with Next Generation's partnerships model. This helped us to develop that diagram you saw on the previous slide, emphasizing employer engagement as a priority. With each step forward, Charleston Metro Chamber of Commerce consults its partners and regional data to ensure its efforts are pointed in the right direction. New partnerships are always being sought to strengthen the network of this healthcare partnership and expand our reach to impact the entire region. As our work persists, its sustainability will depend on the dedication from its stakeholders to prioritize the needs and aspirations of the community it serves so that we are driving positive change. To effectively address this problem, it's important that we have a full understanding of regional disparities related to race, income, and education, and fully understanding how they relate to each other so we can develop effective programming and solutions. The data collectively here communicates that current systems do not provide equitable and inclusive access to quality career pathways and emphasize the need for intervention by government, nonprofits, and employers. 87% is a significant number. White households are making 87% more than Black or African American households. We're also seeing that 17% of Black or African American households are likely to be living under the poverty line compared to only 7% for white individuals. We're also seeing that only 4% of low-income households or individuals are achieving a bachelor's degree or higher. For the entire population, that's 41%. And we also know that having a bachelor's degree can increase weekly earnings by up to 40% compared to those that just have a high school diploma. So you can see how these all play together to prevent people from really moving themselves forward in terms of economic mobility. Low-income and minority communities in the region often have limited access to high-quality public education as well. This truly exacerbates the economic disparities that I described on the previous slide. Schools serving these populations are frequently underfunded, resulting in inadequate facilities, resources, and educational opportunities to prepare students for a plan for their future. This educational gap hinders students' abilities to gain the skills and knowledge necessary for high-paying jobs that offer economic advancement. Specifically, in 2023, we found that schools in our region, Title I schools specifically, were only preparing 50% of their students graduating for college or career. It's 70% for those that are non-Title I schools, indicating a need for support to be offered to students that are falling in that gap to help them attain credentials and training necessary that can get them into a job that offers a quality career pathway. Once economic and educational barriers have been overcome, marginalized communities also face bias in hiring practices, workforce discrimination, and unequal access to professional networks and mentorship opportunities. The National Fund for Workforce Solutions highlights that racial bias in hiring impacts the Black-white wealth disparity. Discriminating practices lead to lower employment rates, reduce income, and fewer career advancement opportunities are available for Black individuals, which perpetuate that economic inequity. Educating employers on this issue and the history of systemic racism and inequities in the region is crucial to reducing these barriers. The Charleston Metro Chamber of Commerce aims to address challenges along the full continuum of this job search, from training and job hiring to providing a culturally inclusive environment once people are hired. We've established 3 priority goals for our regional action plan. The first being to improve access to jobs, offering economic mobility for low-income and minority individuals. The second is to increase employer involvement in career pathway planning. And the third is to reduce racial bias among employers to create more equitable and inclusive hiring practices and work environments. We've developed key performance indicators for each of these goals to ensure we're able to measure our progress and improve as needed. The first for our first goal is 30 low and middle income workers will be placed into well-paying jobs that provide opportunities for upward mobility. Second is that we'll have 30 incumbent workers be upskilled into patient-facing roles. Our employer partners have expressed a desire to engage their own internal workforces, and we want to support them in achieving that goal. And then finally is to recruit from all 10 of the rural municipalities within the Tri-County region that may not have had access to programs before. The indicator for our second goal is that 4 employers will commit to changing recruiting, hire, and training practices to improve more opportunities for low and middle income workers to secure jobs. Here we're really focusing on career pathway planning. And for the last goal, we're focusing on getting 15 HR professionals and hiring managers to complete racial equity inclusion training, which is provided by our local YWCA, to ensure that people are fully understanding of the challenges that the people they're hiring are facing. That's the conclusion of today's presentation. We hope that you've taken something away from our regional action plan. We are always looking to include new partners so that way we can expand our reach and have greater impact. And we hope that we were able to inspire similar efforts in other areas in the country. Thank you.